Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma. It's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crown glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patch hair. However, with increasing pollution and the increase of stress in a daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Athira Mohan is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS MD specializes in dermatology, cosmetology and trichology. She currently practicing as consultant dermatology at Serene Derma Laser and Skin Center Trivandrum, and Dr. Athira Mohan has dedicated her career to diagnosing and treating a wide range of skin and hair conditions by providing personalized hair care services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Athira Mohan is also aware of the need for the patient education about hair and skincare and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer the questions on hair care for us today. Welcome to this YouTube live show.
Thank you so much for inviting me.
Dr. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So today we are going to talk about hair care in current scenario. So whenever we talk about hair care in current scenario, the very common problem which is faced by all of us is hair loss. So can you please enlighten us with your profound experience, like what's normal and meant to be concerned for?
Nowadays, I think many of the people are aware of the fact that the shedding 100 hairs per day is considered normal, right? But provided there is 1 lakh scalp hair to start with. If a person is already partially bald, then shedding of 100 hairs per day is not considered normal. So if you feel there is excessive hair loss, if there is considerable reduction in the density of hair, if you think your thickness of your ponytail has reduced considerably, and if there is recession of the hairline, if there is gap seen on the scalp skin, if you can see the scalp skin is visible in many of the areas, then definitely these are matters of concern and you need to consult.
Okay, that's interesting, doctor. So, doctor, now that when people who have hair loss, they keep asking themselves why it is happening to you, why it's happening to me. So, can you please enlighten us, what are the general causes of hair loss?
There are n number of causes for hair loss, but what we encounter commonly in our OPDs is one most common cause of hair loss is telogen effluvium, which is excessive hair shedding without much hair root thinning. And this occurs when there is preceding physical or mental stress. Physical stress, as in if there was any viral fever or surgery, or in case pregnancy and delivery, all these can cause hair shedding. So this is called acute telogen effluvium. And if this telogen shedding is persisting for long term, like if there is any associated nutritional deficiencies, or if the stress is persisting, the telogen shedding can also persist, and this is called chronic telogen effluvium, in which case there will be reduction in the density and thickness of the hair as well. This is the most common type. Then the other most common cause of hair loss is the androgenetic alopecia, which can be seen in both men and women. In women, we call it female pattern hair loss, which commonly present in males. It commonly presents as recession of the hairline, especially the sides, and there will be thinning of the vertex. Females, there will be widening of the hair partitions. That's how they present. So this is basically due to genetic and hormone causes. Androgenetic alopecia is basically due to genetic and hormonal causes. Then another common cause of hair loss, which presents with localized patchy hair loss, is alopecia areata, which is a completely different entity, which is an autoimmune condition causing hair loss. And there are also other causes like scarring alopecia, which are relatively rare. So the importance is that when you experience hair loss, consult a dermatologist, get your scalp assessed, and identify the pattern or the cause of hair loss before taking treatment.
Okay, very interesting, doctor. So, doctor, like now that we know what is hair loss and what are the general causes, another very common question is like, what are the medical treatment options for hair loss? Like, people are very confused about it. So, with this platform, can we now, with your profound experience, can you please enlighten us, like, what are the medical treatment options available for hair loss, like surgical, non-surgical, or any other?
Definitely, there are a lot of medical, surgical, non-surgical treatments available for hair loss, treating hair loss and for hair
Mhm,
growth.
mhm,
Uh, First of all, get your blood check done. Look for any deficiencies like iron deficiency, vitamin D, vitamin B12. If all the levels are normal, if at all there
mhm,
is deficiency, correct them first.
mhm,
Then check for any thyroid dysfunction, any hormonal dysregulations,
mhm,
because these are all correctable factors. If at all there
mhm,
is any deficiencies or hormonal dysfunctions,
mhm,
address them first, correct them first. Maybe they themselves can can resolve your hair issues.
mhm,
Then coming to telogen effluvium, not much treatment is required,
mhm,
frankly.
mhm,
Just providing nutritional support to the hair can is sufficient for hair growth. But at
mhm,
times, depending upon the severity of hair loss, you may be prescribed with some hair growth peptide serums.
mhm,
For androgenetic alopecia, again, the only FDA approved treatment are one is topical minoxidil,
mhm,
oral finasteride, and
mhm,
low-level laser therapy. In addition, there are other modalities like PRP treatment, platelet-rich plasma treatment, growth factor concentrate treatment, which is an advancement of PRP,
mhm,
mesotherapy, dutasteride injections. These are
mhm,
all recent advances which help in hair growth. Even in female pattern hair loss, they can oral anti-androgens may be prescribed if
mhm,
there is hormonal dysfunctions associated. So, depending upon the grade of alopecia, the
mhm,
severity of the hair loss, it will be decided whether to go with topical treatments alone, or to add on oral medications, or to add on any other procedural treatments like PRP, PFC. Or if there is very significant severe balding, maybe hair
mhm,
transplantation can also be considered in that cases.
mhm,
So it all depends. In alopecia areata, which is a very totally different condition, it's an autoimmune condition. So treatment is completely different. You'll have to take some oral immunosuppressants like steroids,
mhm,
topical steroids, sometimes intralesional injections may
mhm.
be used for alopecia areata. Again, that depends upon the severity of the disease.
Okay, that's very informative, doctor. So, doctor, like there is one word called nutraceutical, which is getting a lot of focus nowadays. So, what is this nutraceutical, and does it play any role in hair health?
Nutraceuticals are getting very popular nowadays, as you said. It is a recent hype, I must say. So these are basically
Yeah.
naturally derived compounds, which are
Mhm,
mostly plant origin, phytochemicals
mhm,
mainly,
mhm,
which actually they address the various confounding factors or triggers of hair loss, like mental stress, nutritional deficiency,
mhm,
oxidative stress, and environmental pollution,
mhm,
etc. Like most of these contain vitamins, which provide nutritional support to the hair, antioxidants, and even some of them can inhibit 5-alpha reductase enzyme, which is the enzyme that converts testosterone, the male hormone, to the active form, which is responsible for hair thinning. So there are such hormone inhibitors as well among these nutraceuticals. The problem is that, or the thing is that, these are not, unlike proper drugs, these are not subjected to rigorous standards by or quality check by the FDA or FTC. So, more researchers are yet to come for a complete relying on nutraceuticals, more standardization of the dosages of these ingredients, the studies regarding the bioavailability of these nutraceuticals, whether these become potent or active when once they are in vivo. And the side effect profile, as I already mentioned, many of these are hormone inhibitors, so these are contraindicated in pregnancy. But there is a general thought that nutraceuticals, these are just vitamins, anybody can take it with, they're not, they are devoid of any side effects. So it's not like that. So a
mhm.
proper understanding of the dosages, bioavailability, and side effects are yet to be made aware.
Okay, that's very informative, doctor. So, doctor, like there are so many plant extract like omega. three fatty acid and grapeseed, are they really helpful in promoting great hair growth?
There are many, as I said, there are many nutraceuticals, many plant extracts, like as you said, grape seed extract, which has a compound called proanthocyanins, which cyanidins, which proliferate, which promote the cell proliferation. So hair
Mhm.
follicle cell proliferation is promoted, and also they help in hydration of the scalp, inhibits dandruff, etc. So even green tea extract, which has got epigallocatechins, which are powerful antioxidants and anti-inflammatory. So there are evidences, there are studies that many of these herbal extracts have got a role in promoting hair growth. There is the saw palmetto extract, which is seen in many of the hair growth serums nowadays, which inhibit, again, as I said, which inhibit the 5 alpha reductase enzyme, which inhibit the dihydrotestosterone, the active hormone levels. So it helps in hormonal therapy and androgenetic alopecia. Pumpkin seed extract, which is also acting the same way. Omega 3 fatty acid, also, there is some studies showing
So doctor is some internet issues there, so doctor will be back.
uh, doctor, I think there's something with the internet
Yeah,
connection.
it's okay, doctor. We were talking about omega-3 fatty acids and yeah, yeah.
Yes.
So you were telling that there are some reports which says that it do, but we are still not sure. Yeah.
Yes, but the thing is that the recommended daily allowance of omega 3 fatty acid is less than 3 grams per day, and that too from supplements, it should be less than 2 grams per day. So,
Mhm.
taking excess of omega 3 fatty acid may actually be detrimental to your hair. There are
Mhm.
evidences, there are studies showing that excess omega 3 fatty acid can cause hair loss. So, we
Mhm.
need to be sure before relying upon these nutraceuticals for hair growth.
So, doctor, like there are so many micronutrients and macronutrients. So, how to design a plate and how these micronutrients are important for hair health?
Micronutrients, which include vitamins and minerals, are very
Mhm.
essential for cell growth and functionality of cells. That is true
Mhm.
with the case of hair follicle cells as well. For hair follicle cell proliferation and hair growth, vitamins and minerals are very essential, especially iron. If I say, I've seen in many of my patients, especially young females, coming with hair loss, when we do the investigations, they may be having anemia and low iron. So supplementing iron alone can solve their hair fall issue. So iron is very important. Most often it is not given that importance when it comes to hair fall. Then vitamin D and vitamin B12. If there is
Mm.
deficiency, you supplement them. And there are definitely there are many trace elements like zinc, copper, manganese, selenium, vitamin A, vitamin I mean vitamin B6, etc. So these are
Mm.
also important for hair growth if they are I mean if they are in adequate quantity. But at the same time, if the concentration is high, especially in the supplements, if we take the concentration of dose is high, exceeding the RDA, they
Mm.
may be even dangerous. It
Oh.
is there are studies that vitamin A and selenium excess can cause hair loss.
Mm.
So you must be very careful about that. Even biotin is a like it is given a lot of emphasis in recent days. Biotin gummies, etc.
Yeah,
So
yeah.
if at all there is biotin deficiency, definitely biotin need to be supplemented, and
Mm.
the deficiency need to be corrected for hair growth. But if supplementing biotin, taking biotin for long term continuously doesn't help with hair growth. Rather, it can also long term biotin supplementation can interfere with many of the lab results like thyroid function test, hormone profile panels, and even cardiac markers like troponin results may be interfered by if you're taking biotin for long term. So long term intake of any vitamin supplement, mineral supplement is not advised for hair growth.
Okay, that's very interesting, doctor. So, doctor, like apart from hair loss, we all there is another very common problem is dandruff. So, does dandruff cause hair fall?
Dandruff alone does not cause hair fall or hair thinning, but
Mhm.
if dandruff is not dealt with early, and if it is leading to scalp inflammation, seborrheic dermatitis, we say, then definitely there can be associated hair fall also.
Okay, quite interesting, doctor. So, doctor, like there are nowadays so many hair oils available which suggest that it will help you to grow hair, and and people do apply it. So, oiling hair is boon or a ban?
Both, I can say. So earlier it was we used to say that in especially in Kerala,
Mhm.
we apply coconut oil on a regular basis. We
Yeah.
used Coconut oil has got antifungal properties, and it
Mm-hmm.
is beneficial to prevent the incidence of fungal infections of the scalp, like tinea capitis, which is very common in children. But at the same time, the if your scalp is prone to dandruff, the dandruff fungus is lipophilic that feeds upon the oil on your scalp. So if there is too much oil, again the fungus will grow. Dandruff will become more problematic, and it can also cause seborrheic dermatitis. So oil is not advised in case of a dandruff prone or seborrheic dermatitis prone scalp. Again, as you said, there are many oils coming up recently, like rosemary oil, which is claimed to have properties that is beneficial for hair. Yes, rosemary oil has also some components which help in hair growth, stimulating hair cell proliferation, as well as it has got anti-inflammatory, antifungal properties,
Mm-hmm.
and also improves the blood circulation to the scalp, thereby increasing the hair growth. So there are such oils, but again, as we say, the bioavailability, how far it is useful, is there any side effects, any toxicity? Those things need to be researched further.
Yeah, yeah, yeah. So, doctor, yeah, so we all are having like a very busy work life, and there is a lot of stress in our life. So, does stress also play any role in hair health?
Stress plays a huge role in hair health, actually.
Mhm.
I mean, stress is the biggest enemy of hair, I mean, hair growth, I must say. Stress can increase the levels of cortisol in your body.
Mhm.
Hormonal dysregulation can be caused, that can cause arrest of hair cycle. And
Mhm.
even stress, as I already mentioned, it is the one of the most important cause for telogen shedding, telogen effluvium. And also other kinds of hair loss like alopecia areata can be triggered by, which is a patchy hair loss that can also be triggered by stress. And some people pull their hair as a way of dealing with stress. So that can also cause hair loss from selected areas on your scalp. So in total, stress is detrimental to your hair.
Yeah. So, doctor, finally, my favorite part. Can you give us some important tips for healthy hair?
There is no magic. You should take care of your hair. You should eat healthy. Manage stress, which is very important. Stress management is very important. Take professional help if needed, or we can use some relaxation techniques to deal with the stress. Then you should develop a proper hair care routine. As nowadays, skincare routine is very trendy nowadays. So similarly, you have to develop a hair care routine as well. Use products which are suiting your scalp according to your scalp and your hair type. Um, Use shampoos and conditioners on a regular basis. If you have dandruff, go for an anti-dandruff shampoo once or twice weekly. So yeah, then avoid using harsh chemicals on your hair, heat styling your hair frequently, all these things to be avoided. And don't take new, I mean, like supplements randomly from online stores. Rather, get assessed, get consulted by your doctor and get your scalp assessed, identify the pattern of hair loss, and take treatment accordingly.
Okay, this discussion was very informative, doctor. So, can I take some live audience question?
Okay.
Hi, doctor. How can I get your appointment? And also, can you tell me कि hair transplant के बाद बाल गिरते नहीं हैं क्या?
Uh, can you repeat the question?
He is asking how to take your appointment, and also after hair transplant, like hair are like permanent, whether it will fall or not fall, or is
Oh,
there
okay.
any?
Uh, One thing you must understand is that hair transplantation is not a one-stop solution. I
Hmm.
always say my patients, many people will be waiting for their hair to fall so that they can go for hair transplantation. It's not the case.
Hmm.
Even the transplanted hair will go.
Hmm.
Earlier, it was thought that once the hair is transplanted, the transplanted hair will remain the same, but the other areas can again be affected by androgenetic alopecia and they will eventually fall. But now the latest studies show that the transplanted hair will acquire the characters of the recipient area where it was
Hmm.
and it also will go eventually, it also falls eventually. So even after hair transplantation, the hair care should continue. You should continue using a minoxidil solution on a regular basis. You should also get growth factor concentrate injections or PRP treatment done at regular intervals so that you can maintain that hair for long. And you can get my appointment at Serene Derma in Trivandrum. It's
Yeah.
uh, you
They
can.
can Google your name there to your Serene Derma clinic, skin and laser clinic. It's in Kerala, I think. Yeah.
Yes.
So another question from our viewer is, Doctor, can you please tell me that it is very common to have hair fall during monsoon season?
That depends. That depends upon the different. It is very subjective. Whether some for some people it may be a change in the environment which triggers the hair loss. If
Mhm.
traveling can trigger hair loss, when they move into new places, adjusting with the water. That can trigger hair loss. So there is nothing like monsoon season. There is increased hair loss, but it depends upon the it is subjective, individual variations there.
So finally, Doctor, would you like to give any take-home message or any other suggestion to our viewers today?
The same thing, take care of your health, the general health. I always say skin and hair are reflections of your internal system. So,
Mhm.
correct internally first. eat good, eat a balanced diet, exercise, stress management is important. At the same time, for your hair fall concerns, don't Google and randomly order products from online stores. Rather, check your blood for any deficiencies, if at all there
Yeah.
is any underlying deficiencies or thyroid or hormonal imbalances. Correction of these are very important. And then consult a dermatologist and identify the cause of hair loss, and accordingly take the treatment. Doctor may prescribe some nutraceuticals or topical or oral medications depending upon the severity of your hair fall.
Thank you so much, Doctor, for sharing all the information and your expertise with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very helpful. Thank you so much, Doctor. It was delightful to have you, and thank you so much for your very valuable time. Thank you, ladies and gentlemen, for joining us today, and uh, thank you for giving such a lovely comments and so many questions. Hope to connect with you all with our doctor again with a new topic if she has time, and we will discuss more and create more awareness. Until then, let's see you again, and have a nice evening, doctor.
Have a nice day too.
Bye bye. Take